Is there anything besides, the way to minimize compress? What do you say? It's compression, or what is it again?
So there's some narrowing through some of those. They're called the foramen. So this is where the nerves will shoot off. So really getting the radiation and the chemotherapy. And then managing the pain while we get this under control. That's it at this point. So I know Dr.
What's confusing is if you have soft mass and hard mass. I could see the hard mass causing, pressure, but then the soft mass, wouldn't that absorb some of that?
Mm-hmm. So a mass is a mass at the end of the day. I mean, the mass is going to push on the nerves and push on those on the vertebrae, which obviously house the nerves, and then the narrowing that kind of, so the spinal cord, right? And then you have nerves that come, for your spinal cord, and then you have nerves coming through that innervate the body. So you're having narrowing on those foramen, and those are going to be pushed on the nerves. The soft tissue mass pushing on the vertebrae, causing more of these symptoms. And then, so this is going to cause your symptoms. So hopefully with the radiation calming that down, as well as the chemotherapy, once we can get that started, this will start decreasing those things, getting the numbers under control, and hopefully, then we can get these pain, obviously the pain meds are in the interim, the Decadron, the IV that you're getting right now, this will all calm things down, but this is a Band-Aid.
Sure, right? I get that, I totally get
that. So we got to get this treated, and once we can do that, because I'm going to get a follow-up appointment in your chart with Dr. Alsawa so we can get that ball rolling, but in the interim, obviously Dr. Johnson can get the radiation part going. So we'll work together with that.
Is there a way to specifically document the size and changes? I've had two different, I don't know, I've talked to like many specialists like yourself, whatever, about hearing some rumor or this looking at that, and some signs of decreasing in the tumor size, not to mention just the pain. Like the pains have dissipated. Like my pain down here went away. The pain, I had some all gone. Like a lot of signs, and then the nurse, I don't know who she was, but said, your tumors have, shown to minimize, da-da-da-da. I don't know. All I know is I'm going by hearsay. Is there a way to document actual size from when I came in to current?
Well, I would have to go back to your McLaren files from Macomb to see where the origin were to. But these doctors, when we do MRIs, they're always using comparative imaging.
Sure, and that's been another challenge because, I'm a little surprised, but not. But I mean, I get what you guys are dealing with, but a lot of it comes into telephone talking, and then it's like, you're either going off an assumption or it's like, I was just a little surprised that all the network wasn't completely there. And I get legalities like, release this and that, but, we should have access to everything, ideally.
We don't have, our doc EMR, so our medical record, is actually, surprisingly, which I don't get, we're all McLaren.
Right.
We don't have access to that. They use a different EMR.
So it's a request, and then it's...
So I have to request things, which we have those in our system because we requested originally. I just haven't looked at them since your new admission from previous, because we've seen you quite a few times. I would have to go back and look, but we do have them.
That's just a valid question, don't you think, to know?
And Dr. Alsawa, I'll mention it to him so he can pull those for you. So when you have
that'd be great.
He can kind of compare the previous MRIs from initials to this most recent.
And the hardest part is I have so many therapies, and if you can only imagine all the stuff I'm going, and then just to remember this. And then if you don't remember, right, and then let's say you do remember, but you hand it off to ask for the request and don't get it. I cannot tell you how many balls have fallen for, I guess, to my point, impertinent information enough that would at least give some oversight that it falls in the wayside, which has led to a lot of just inconsistencies with us understanding what the hell is going on. And then add in the emergency visits and everything's just, discombobulated.
Like I said, I'll mention to Ferris, so when your appointment comes, he can look at your first MRI to the most recent. So he can kind of go over that with you.
Yeah.
Okay? And obviously some of the therapies, though, you did receive some radiation, so that helps shrink things, obviously. That's the job of it. Decadron helps calm things down. It's a good medication. So, but these, again, they're going to, once you get off of it, things are going to start coming back.
But would a radiation treatment on my L5 do anything to dissipate any pain in my upper, or these ones up here that... So that's what I'm saying, why would they all show minimize pain? And then obviously the massive increase in pain where the surgery doesn't make sense, dude. So,
like I said, I will definitely have Ferris go over that with you. Okay. So in your appointment, you can get a kind of idea where things are from before, or at least the start, to now. Perfect. And I will have him go over that. Because again, I did initially look at this, but this was a month ago.
Yeah, get it, man.
Came in and we got all this stuff.
And I'm like this, special case that I don't want to be, but we have a lot of questions, and just, I want to get healthy and I want to do it. But, a lot of times it's like, here, just do this and hope that works for you, versus a little bit more of a strategic process looking at facts and data that we can't seem to accumulate properly because of, this waiver and it's at that hospital. And God forbid I was like at 3 or 4 or 5 different hospitals. I don't even know if those people could do any of that. At least
That
I'm in the
complicates
network.
things. I mean, at the end of the day, yeah, so your symptoms are kind of waxing and waning, and you've been on some treatments, and we're giving you some of the medication that can help calm things down. But at the end of the day, it doesn't matter what the MRI shows initially to now, you have your spine or your multiple myeloma biopsy is consistent like with 80 to 90% of these irregular cells. So I know you want to get an idea where you're at, but that does not change the plan. You need this therapy.
Totally, yeah.
So that doesn't change no matter what. But at the end
Not
of the
a
day, I get
problem.
where you're at. You want to know where you went.
Yeah, just
starting to where
progress,
you
and
go.
like,
Yeah.
because I do have a lot of things that are, I feel I have energy. There's a lot of things that are like, I feel great if I didn't have this stabbing pain.
Yeah.
But anyway.
Well, we'll get everyone, like I said, Dr. Johnson's working with us, so we'll be kind of working with him. I will speak to Ferris today.
What about Parzan?
He should be, Dr. Parzan, sorry. Dr. Johnson was here last week.
Yeah.
I think Parzan's in this week, so you'll probably be seeing
And
Parzan.
what about Al-Sawi? Is he going to
And
be?
then Ferris is not rounding this week, that's why Dr. Law's here with me, but Dr. Law's in the clinic. But Ferris is in the in our clinic today, so I'll stop by and see him, and I'll talk to him and touch base. So when you see him, I'm going to get the appointment. I'm hoping by next, this is early this week, but by the time you get out of here and stuff, we'll probably just have the appointment early next week. For an appointment with him to discuss, like, hey, this is going to be the treatment now.
And what was that drug you said just earlier? I forget. It was something with an F. They said this and that drug, or what?
For what?
You said some drug, and I didn't remember. I never heard of it. In our beginning, when we were first talking.
Today?
Yeah. Something with an F.
Oh, the Decadron.
Yeah, what is that?
Decadron's a steroid.
Yes.
That's the IV
I will
steroid.
tell you that every time I get discharged, they take me off the steroid. And I think and I know it's probably not good to keep me on this high steroid or whatever, but I do feel it's another way to keep me stable and out of ER.
Yeah. Well, I'll discuss that with Ferris if he wants. Again, you're right. You don't want to be on extended steroids because it's not good. And you've been on this IV, which is, works great. It truly does. It's probably one of that's one of the treatments with multiple myeloma patients is that when we can't start treatment yet because hospitalizations, whatever.
Yeah.
Decadron is one of the things we can at least start to keep things under control. So
Okay.
I'll discuss with him if he wants to continue on steroids once you get discharged. And obviously until we can get these appointments rolling so we can get everything
Save me, man.
treated.
Save me.
And then I know pain management's seeing you and they're going to keep you on the Dilaudid now because
Yeah,
you tried
thank
the other
God.
things.
Honestly, I rave about it, and I know they got these bad, it's going to get addicting. I don't know what their thing is, but I've tried almost everything, from mentally to physically, everything. I feel good on it. I think clearly on it. Takes the pain away, and I think we won't have to deal with these ER visits anymore if I can just get. And I know there might be a challenge with getting the prescription, but if I'm coming here for treatment, they said I got a 3-day prescription. I'll just get it when I'm here.
Yeah, and then when you follow up with pain management, they can give you longer scripts, but from the hospital, they can only do 3 days.
Your name again, one last
David
time.
Smith.
David, man.
Yeah.
Thank you. I really appreciate you.
Yeah,
just
no problem. I'll
talking to me.
talk to Ferris. Like I said, when I get back, I'll go pop in on him and I'll discuss some of these things. Obviously, he'll be prepped to discuss MRIs, but I'll discuss the Decadron with him as well, okay?
That's awesome, man.
All right.
Thank you, David.
You're welcome, Spencer. You take care, okay?
You too.